Hello everyone, I am Dr. Santosh Kumar, orthopedic surgeon, orthopedic and joint replacement surgeon based in Kolkata. I had founded and I head the Momentum Orthocare, and before this we had several educational videos on various orthopedic issues. So today we are going to talk about knee arthritis. Knee arthritis is a very prevalent issue in our society today, with more and more middle-aged as well as seniors getting affected with knee arthritis. So majority of the knee arthritis that we see is actually osteoarthritis, which is time-related, age-related wear and tear of the knee, the way our car tires wear out. And it is universal. Some people may get affected earlier, some people may get affected later, but it's rather universal. And along with that, sometimes we see secondary osteoarthritis, wherein there is a definite reason for the wear and tear to start earlier than the natural wear and tear, and that would be because of a trauma, because of a fracture. And sometimes of course we see genetic arthritis like juvenile chronic arthritis, juvenile rheumatoid arthritis, wherein arthritis starts much earlier age, even maybe 15-20 years of age, and may need very early knee replacements. So the issue with arthritis is that especially in osteoarthritis, the issue with osteoarthritis is that there is no specific medicine for this, and it is progressive in nature. So along what happens in knee osteoarthritis, this is the normal knee joint, this is the smooth normal knee joint. So it wears out the way our car tires wear out. So along with this wear and tear, there is bending of knee. Like a normal knee is supposed to be straight like this, but it in osteoarthritis bends this way or this way. So in osteoarthritis, the knee starts bending, and this bending of knee is also progressive. This bending of knee is also progressive in nature, and we see this in x-rays. We can see this in x-rays, how it is bending. Now this osteoarthritis leads to pain and instability. There is increasing difficulty in walking, and there is instability, there is waddling gait, which in turn leads to back pain, spine pain, and sometimes radiculopathy, that is pain which is descending from back to the legs. So this is the problem with osteoarthritis, that it is progressive in nature, and this instability leads to fall. Majority of the people who would have fallen and had fractured neck femur, they had fallen because of bent knees. Bent knees is a serious issue, and it leads to fall. So in these cases, whenever there is bending of knees because of osteoarthritis, we have to plan knee replacement in various situations. So knee replacement, we replace this wear and tear. This wear and tear of the knee is replaced by a new surface, which is known as knee resurfacing or knee replacement. So this is knee replacement. Now in early cases wherein the knee is not rigidly bent and it's still correctable, what we call correctable deformity, we can go in for partial knee replacement, wherein only the one compartment is replaced and the remaining knee is preserved. So that is called unicondylar knee replacement, or UKR. But in majority of the cases, we still need to do the whole resurfacing, that is known as total knee replacement. This knee replacement is generally a very life-changing surgery. The bent knees are corrected at once. This is a lady who had bent knee before surgery, and the knees become straight after surgery. So it is a one-step correction to all the deformities of knee, and that's the greatness of knee replacement. So this is a life-changing surgery. The bent knees are corrected like this. So this is a life-changing surgery. This gentleman had come to me in a very late stage of osteoarthritis, where the knees were bent like this and it got corrected like this. So this is a life-changing surgery. Now coming to the recovery, the person, one starts walking from the very next day of surgery. Like if we do the surgery today, he or she will start walking from the very next day, and we use a walker or a supporting walking aid for first 2 to 3 weeks. By the time of discharge, one is independent with regards to toilet needs, able to go to washroom, sit on commode, climb few steps stairs, and full recovery takes around 1.5 to 2 months for the body to accept it, muscle strength to develop, and after the surgery, one has to do muscle strengthening exercises. Now there are various questions with regards to the type of implant, which is the best implant, which is the best TA. So one needs to understand that this knee replacement is an act of mechanical engineering. It's the precision, it's the physics that is involved. It's the millimeters, degrees, it's the placement, balancing, even balancing. So it's the surgeon's expertise which is most important. And along with expertise, surgeon's expertise, we have been using technology, the most advanced technologies. Like since 2012 we were using computer assisted technology. Presently, since 2019 we are using robotic arm technology. So that leads to enhanced precision. But still, the most important factor is the surgeon's expertise, surgical precision. And the precision is always high in a place wherein a lot of surgeries are done. So we do around 10 to 15 knee replacements daily, and we can assure you that we will give you the best and the safest and highly precise surgery as far as knee replacement and hip replacements are concerned. We have been using this robotic arm, which is a very advanced system. We have active as well as semi-active robot, and this increases the safety, the flexibility, and this is one of our robots. We have several robots. One of our robots, this is the console, and this is the robotic arm. This is the robotic arm. This is for increased accuracy of the surgery, increased precision of the surgery. And along with this, we have been using stitchless knee replacement, wherein there is no need of cutting the stitch. But of course, stitchless knee replacement may not be possible in every cases, and we selectively do in the cases in which we choose. Along with this, we have been using mobile bearing knee. This is a titanium niobium implant, and this is a mobile bearing knee, which knee bends not only like this, but for deep sitting, high flexion, it rotates also. So this is known as rotating mobile bearing knee, and it gives deep flexion. It enables one to sit cross-legged, the Indian cross-legged posture on bed. And this is we make it as painless as possible. And this is a patient who on the day 2 of surgery has bent his knees like this much. We can assure you, I can assure you that at over here, right here in Kolkata, team Momentum Orthocare, I and my team, we will give you the world's best knee replacement surgery as the most effective prices. Whatever is most advanced on this earth is available in orthopedic surgery, is available here with our team with Momentum Orthocare. So if you have any knee issues, please do feel free to visit us at Kolkata at Momentum Orthocare, and you can always contact me at my WhatsApp number and my email ID. My WhatsApp number being 62899962271.